The process of this is going to be, I'm going to introduce the panel speakers you have not seen and request them to give a very short summary of sort of the issues that they saw from the earlier session today. And I'm going to lead off with a set of questions and start encouraging discussion, which can go to any member of the panel that are present. And to start getting questions, I first like to introduce Charles Beard from CDC and just ask him to give us a short synopsis of what he thinks from what he's heard earlier and some discussion.
So kind of in summary of some things that Nick said, and actually my role at CDC is sort of twofold. I say my unpaid night job is Associate Director for Climate Change for the Infectious Diseases side of CDC, but my full-time job is vector-borne diseases, and so Lyme disease and other vector-borne illnesses. So most of my comments will kind of be in that direction. But to reiterate what Nick said, I think what the ultimate goal is to be able to correlate human risk to vector population densities and climatic variables so that we can project how we think that climate change is likely to impact disease risk in the future. And so to do this, we really need a significantly amount more of information really on the distribution and abundance of vector populations, such as the black-legged ticks that Nick mentioned, Ixodes scapularis, that are vectors of Lyme disease, other borreliosis, Powassan encephalitis, several other diseases. And we really need to know how associated temperature and precipitation data, how that impacts population densities. And that's a huge thing. It happens at local levels, and there's a real need for that data. We also need information on local disease occurrence. As you may know, diseases are reported. They're reported by county of residence, not by where you may have actually been exposed to the disease illness. So if it's a travel-related illness, that's not captured in the reported information. To take this a little bit further, we need additional information on disease burden. And as you may know, there's 37,000 cases of Lyme disease reported in the U.S. last year. The actual number of cases is probably closer to 400,000 cases. And we know that from underreporting studies we've done, from a very recent market scan insurance database study. That's done on 3.4 million diagnostic tests a year on 2.9 million people, to the tune of $490 million in the U.S. just for diagnostics for Lyme every year. And I think the economic importance of this is really huge. And it's going to be very important to be able to make these economic cases if we're ever going to get support to model these things and do the research that we need to do to have better projections. And then finally, the last thing I'll say is that we need to continue to push these models to finer and finer resolution scales, because public health is done at local levels, and the response is a local response. And so if we have national types of projections, that really doesn't help Larimer County, Colorado, or here in the east. Larimer County is where we are, CDC in Fort Collins. And those decisions are local decisions, so we really need better predictive models for local scale. So I'll stop with that.
Thank you very much. Next, I'd like to bring up Mary Hayden. She is from the University Corporation for Atmospheric Research.
National Center for Atmospheric Research. That's okay.
I'm trying to read it.
That's what I know. It's okay. But thank you. I appreciate the opportunity to speak to everyone here today. And I'd like to just continue with the theme that Ben left off with, and that is the role of scale in dealing with these problems. They're spatial problems, and we really need to think carefully about the role when we are addressing these types of problems. And so I'm going to harken back to some of the earlier discussions about heat and just give an example of one of the ways that we're trying to deal with spatial issues when it comes to heat. So we know that impacts, we know that risk, we know that vulnerability, as well as adaptive capacity are all spatially differentiated. We know that national and regional assessments are great, but they can also mask communities that are living in marginal conditions. So it's important that when we're thinking about hazard mitigation, when we're thinking about climate change adaptation, that these are all adjusted for the local ecology and adjusted to an appropriate level of decision making. So local level assessment ensures a more targeted intervention, response, and adaptation. So I wanted to just give an example of some of the the types of questions that we're asking in response to heat waves, for example. So how do heat waves in present and future climates affect human health in environmentally, socially, and economically diverse urban settings? How can we characterize, how can we measure, and how can we model societal vulnerability? And what if we know who's vulnerable? So what? What if we know where they are? What are we going to do about that? So how would we use or communicate this type of information? So I have maps in front of me that I can't really show you, so I'm going to try to describe it really quickly. We've developed a relative risk map of heat-related mortality at a census block group level for the city of Houston, and it's based on mortality counts. It's based on numerical model weather simulations, as well as census data and parcel data. And so it's a hierarchical model that has spatially varying coefficients to help us better understand differential vulnerability. And so what we've learned is that an increase in heat-stressed nights will increase mortality, that extreme heat disproportionately affects the elderly, those who are socially isolated, those who are low income, but also African Americans and people who use public transportation. So maybe no surprise there, but we have this map at a census block group level. And so we've gone a step further with that and developed another map, which, so this is for the health department. So we've developed two maps, actually. One is for the health department that overlays this relative risk map with the ability to look at each census block group and determine what the demographic factors are that contribute to risk at that block group level. So they have all that information. But then we've also developed a public map. Here's what this one looks like. You can't really see it, but what it does is it allows a user to, first of all, click on the block group of interest, and then click on another icon that allows them to determine where the nearest place is that they can go to get cool. So they can look at community centers, they can look at pools, they can look at Walmart, they can also get a distance indicator, how far it is from them, and the hours of operation. And the third thing it does is it allows them to click on the CDC website to also get immediate strategies for how to cool themselves. So those are my maps. And these maps, we think, are really a step toward including drivers of vulnerability at multiple scales. They connect people with the actual place where they are, and they enhance the ability of communities as well as stakeholders to develop a type of proactive program to mitigate risk. So, thank you.
Thank you very much. Next, I would like to introduce Erin Lipp from the University of Georgia.
My background, my interest in this area really on the waterborne diseases and foodborne diseases as well. And I'm really a microbial ecologist, and so I find myself sort of torn when it comes to modeling. I want to know the intricacies of what's happening in that system, but then I also want to know what's the easiest way to get to what the health outcome is. And so I see that tug in a lot of these areas. So I just wanted to make a few points in terms of what the modeling uses really are, especially in regards to waterborne diseases or many of these things. You know, I'm thinking especially in terms of the United States and developed countries. We can use them for future planning. I think the idea of linking it with water infrastructure is really, really important. The examples from the Great Lakes have been, I think, have been really compelling. So if we expect to see more spring rains, how do we make sure that the deep tunnels and storage tanks for the CSOs can accommodate the rainfall that we may see in the next 20, 50, 100 years? So infrastructure planning needs to go into that. We can also use it to look at risk windows, which is really what I've been focused on. What is the habitat suitability and what are the time periods that we would see a change in risk? And then on the nearest term, getting into the early warning system. But I think one of the things that ultimately is one of our big problems, and I know that lots of other people have said this, is a lack of good health data. And this is really, really a big deal when it comes to the diarrheal diseases, which I know globally we're seeing going down, and we don't typically think of them as being associated with mortality necessarily in the United States, but they do have a significant burden. We don't have a really good handle on what the overall burden of diarrheal diseases are. So we really are left with what the likely risks may be in light of not having that data. And then the other point is going to came up in Sari's talk is this idea of agent-based, and this gets into the microbial ecology. what happens to an enterovirus may be very different than what happens to Salmonella enterica in the environment. And while we're looking at diarrheal diseases in general, there's a really distinct difference in terms of how the environment comes to play in those different agents. And so understanding that is going to be ultimately important. But then to end, despite the problems we have with modeling, and just to harken back to what Michelle said, the models are not perfect, but they are telling us some information. And I think as long as we go into that with the caveats of knowing what the problems are, we are getting information out of these models that I think are ultimately useful going forward. And if nothing else, it's identifying research gaps that are really important to fill out.
Thanks to everyone. I'd like to direct folks behind you is a series of focus questions, broad questions that we wanted to bring up and allow for discussion, though it will lead to many other things. It's not to stop you. The first is on what are the opportunities for and limitations to accessing risk research and development needed to strengthen the models. We've heard a great deal about where the state of models are now. We also understood there are very significant weaknesses and very concerns that the panels have brought up to us and made us be aware of. So the question is, what are the opportunities and the limitations? And I turn this to the panel.
Both limitations and opportunities is the underlying data that we need, and I think that it was highlighted very nicely today that there's a lot more access to data than we've ever had before, an unprecedented level of data, which can be a bit dangerous as data can be misused, but also is an enormous opportunity for interdisciplinary research where I think the Giovanni was mentioned earlier today, where you can access information. And I know that in my field and many others, there's enormous emphasis on reproducibility of research, which I think is critically important for climate and health when we want to really understand what those other disciplines are doing. So having access to their underlying data, and in many cases even the statistical code or modeling code, can be very useful. So that's something where I see a nice path forward where we need to link people from different disciplines with this growing trend towards more access of data and underlying methods.
Other members of the panel? Jump right in, guys.
So this is Juli Trtanj. I actually was I'll just follow right on there. So I think that it's actually an opportunity as well, and a bit of a risk on the data side, but two different pieces of that. The part you might not think about is the role that we have in determining what data are collected and how they're housed on the environmental side. And absolutely we have long-standing issues with the availability and access to public health data so we can get to those endpoints. That's unquestionably one of the most challenging areas. But on the Earth observation side of things, I think as a community we can begin to define what it is we need from the Earth observation community a little more clearly as well. So I think in terms of a forecast product, in terms of a temperature threshold and some of those other things, I think we need to be thinking about feeding back into that machinery of how we observe the Earth. And that leads me to another, what I think is a real opportunity from sitting in the Earth ob side of things. Public health folks help make us relevant. Oh, great, you use a forecast. But something useful, which we have a lot of that. But the other thing is, I think from a data management and an observing side, we have people who spend their entire lives on how to manage data. It's a respected career. There's big international work groups on how to do this. So I think we can learn from each other on how to do this data sharing thing as we move forward, which isn't exactly about how to get to a climate forecast, but that's an underpinning, how to do the data sharing, the integration, and identify exactly what we need. And that gets me to the second, what I think is an opportunity, and I'm actually quite curious. This local issue, you heard a lot from me. We're starting at a local scale because we're starting with what decision makers need, and yet, global climate change is big models. And I'm actually really quite curious. I don't know that you scale up from that all the way out, but I'm curious how to strike that balance, because that reproducibility at local scales, how do you do that so that you don't have just a bunch of one-offs, but how do you do it so that they're consistent and still at a scale people need? And I feel like that's the real challenge and opportunity.
There's a real discussion across the board in terms of dealing with observational data on a very large scale and try to downscale it so you can actually put it to something you can put your finger on and say, I know that's what's happening here. And so that is a question that comes about with the whole climate modeling discussion. The fact is, you may be able to do some work very well at the larger level, but then when you start getting to lower levels, there's a series of tremendous uncertainty because you don't really know what the processes are when you're getting down to there and if they really are appropriate. And you folks did a great job of showcasing how when you would zero in on a more localized aspect, either from disease vectors or other conditions, things can be very, very different in a very small spatial area. And then how do you do public health with that when you have this kind of variability?
Comment on what Juli said a minute ago about publicly available data. And, you know, it's sort of a two-edged sword there because I'll give a short story. Our first meeting CDC had formally with NOAA a few years ago to discuss collaboration. I was showing some figures of national Lyme disease data over the last 15 years, and one of Juli's colleagues said, well, I think I see El Nino effect in your data. And it was in 2003 when we had a big dip in cases. And I said, well, actually, that was the year Connecticut stopped mandatory lab-based reporting, and so the cases went down by 5,000. And so it makes a really simple point that databases are databases, but there are all kinds of caveats. And so when we talk about making data publicly available, what we really need is to merge collaborations with people who understand those databases, not just taking that data and putting it into a model. And that's really a huge need, at least in public health. I can't speak for the weather data, but...
Yeah.
I encourage us then to look at the second question, which is where are the existing models headed? What are their data needs and what you need to accomplish? Because we're already starting to point at things which are needs, that we need to do this differently because otherwise we're going to end up with apples and chainsaws and thinking we've got apples, you know, kind of thing. So, but I'm curious. Go ahead.
Yeah, just a comment about more attention needs to be paid also to the social side, the social determinants. So, you know, in one way, the environmental modelling is way ahead. You know, lovely large data sets and also quite well made, or available. But you know, projections around poverty, projections of urbanisation, projections of where people are going to live. Are they going to be on the coast? You know, we don't have that, and that's crucial for a lot of the disaster risk mapping. And you know, I didn't put it in our talk, but the disaster risks actually get worse as people develop because of this urbanisation bit, and then they get better. Whereas it's not just this linear effect. So until you model those sorts of risks and have better data on those, you're kind of missing some of the future risks. So it's a plea for more demographers, because demography really is not doing very well, I think, and all the demographers seem to have disappeared. So we need all the demographers to come back and help us. Yeah.
But that does bring up a thought about the existing models, is that we need to think beyond our one niche area and say, I know this, but now we have all these other factors, because they seem to be very much human behavior may be very appropriate of how people are exposed to certain risks that otherwise they may not be. But so the one thing that comes up is their data needs. I'm hearing two different things. I'm hearing there is a lot of data, and then there's not enough data. Or is it just the scale of the data? Yes, this is true.
I think both are true to some extent. I think that we have a lot of data. We don't have data that's been collected in a way that is desirable. So we're usually dealing with something that has been collected for some other purpose. Mm-hmm. We rarely see, I mean, from my perspective, systematic surveillance. I think that our recent entomological surveillance in Canada, and particularly the tick surveillance, the passive tick surveillance, is actually a pretty unique data set. It's about nearly 20 years of collecting ticks in the same way over the, which is pretty uncommon.
Could you give a better explanation? I mean, I just don't know for sure. When you talk about systematic surveillance, is that actually looking at the disease vector, or is that looking at the population affected?
It's not. It doesn't matter what the subject is. It's the way that it's collected. Mm-hmm. In other words, it's not collected in a way. Oh, this month we went out. Next month, well, we went out a couple of days. Mm-hmm. The year after, we didn't do it at all. Sort of that and you know, we did it. Instead of going out, we go every month, or we collect this data all through the year, and we do the same analyses on them, and so on. Sometimes that's pretty uncommon. It's understandable. A lot of the data is surveillance and data, and we're dealing with this now with fortunately, I guess, 2012. I shouldn't say that. It was about it was a very unpleasant outbreak for a lot of people to deal with. But at least we carried on doing surveillance for West Nile, because there's a tendency to think that, well, the problem's over now, we can just shelve that program and it's done. So, there are some clear reasons why we don't have long-term data sets under certain circumstances, but they have a huge amount of benefit.
And just taking the 5 to 10 year time period for folks looking at your field now, the 5 to 10 year time period, what do you think are the things that will be the most, where the models will go, and also sort of the results in the next 5 to 10 years, because we can get to very long-term scales on these things in very long-term collections. But curious, in a sort of grounded sense where folks are actually doing research, planning research, people are going to be funding research in the next 5 to 10 years. Any perspectives?
Well, I think we're going to have to get to some of the dynamic modeling, and I think the question comes to how much data do you need to do that? But I think everybody's looking at getting beyond statisticals to understanding mechanistic models, and then figuring out that will help us figure out how much data. We know we need long-standing surveillance, and I totally agree with you, Ben. It's about collaboration. I wasn't meaning data. That. So I think one of the trends is going to be looking at some of these coupled model systems, more dynamic modeling, and I actually think, after hearing some of the talks today, it might be making them comparable but at a more local scale. We tend to have started thinking more globally and sort of nationally, and I'm wondering, not saying we're going that way, but I'm wondering if we don't look at more consistency on the more local scale, but more robust modeling exercises.
Yeah, one direction, I don't know if my field is going in this direction, but I think we need to, is looking more at the climate change, environmental health impacts in locations with emerging economies, so locations where we do not have the health data, we do not have the place-based environmental exposure data, but these are the populations that are quite likely to be the hardest hit, quite likely to have the least resources to be able to deal with this problem. And I think that in many cases we've been looking kind of at the low-hanging fruit. As difficult as it is to do these types of studies, it's much easier to do it in a place like Chicago, where I have detailed mortality data and detailed exposure data and so on. But we really need to start looking at these populations that are going to have larger problems due to the resources available.
The other thing I think we'll see is we've now had about 10 or 20 years of warming, so we have got changes in populations to warming, and we can see roughly if populations are getting more or less sensitive to the climate parameters. So heat's the obvious example. Some populations are becoming much less sensitive to heat, but some aren't. So why I'm thinking of in Hungary, they're still having lots of people dying in heat waves, but in England, hardly anybody's dying in a heat wave anymore. So why is that going on? We can explore some of those issues. And the other thing people are looking at is more limits, is the behavioural aspect, which has come up before, is limits to adaptation. We can now work out why people move from the coast, why people don't evacuate in a flood, why farmers don't change their planting behaviour. We actually have some of these observational studies that will inform our adaptation assessments, because we can see what's a plausible adaptation response and what isn't. So I think more evidence, more observational evidence will help us.
That leads to the third question. The issue about scalable and linkable. We're hearing, you folks have all been talking about that very strongly. The issue of scale. Where is the scale really appropriate? And also, how do you link across different disciplines? And I'm hearing strongly that is an issue. Where we are now, that's an area which needs to improve.
My view of the scale issue is that the scale really depends on the objective of the modelling, and it depends on the end user. So, and to some extent the model as well. Just a little bit answering the previous question, I don't think I've come across in recently an issue for which we don't have a tool. In other words, in terms of modelling the spread of the environmental risk or the occurrence of the environmental risk, we have at least some adequate tools to do that. We have some data issues we cannot link that to human case at the moment. And there are a whole load of privacy issues, which for us are also scale issues, because we cannot identify where people are. And that's why we focus very much on environmental risk, or sort of in the research that I've done on environmental risk, because actually trying to get hold of the human case data in some kind of spatial resolution that is useful is exceedingly difficult.
And that is a new observation in terms of people actually talking directly. If that is a major barrier to them, is actually getting access to the data because of the privacy issues in particular. As well as the questions about linkable. Are you seeing, or do you project that in the next few years, folks are going to start understanding the issue about the fact that this is an interdisciplinary effort, that the modeling needs to not only look for the issue of what question you're trying to answer, but you need to make sure you have the right questions and the right blend of expertise available, which maybe historically it would have been a stovepipe where you went this way and someone else went this way.
I could comment on that. I think actually we're being forced more and more in that direction, and I've seen a lot of encouraging signs. I mean, the USGCRP climate change and human health subgroup that Juli and John and George co-chair, a number of us sit on that committee. It's very multidisciplinary, and I often feel that I think most of us would probably agree that health was the last sector to come to the climate change issue, and I think we're way behind everyone else and underfunded and everything else. But I think I'm sorry, I didn't say that. And but I think that we're doing a lot to leverage that. For example, CDC has a postdoctoral training program that we put together with NCAR, the National Center for Atmospheric Research, with Mary, and so postdocs spend a year at CDC learning public health and a year at NCAR learning atmospheric sciences, climatology, access to the supercomputing, so that we can work on cross-cutting projects and actually train a new cadre of scientists who are conversant in these different disciplines of science. And so we've had 2 cycles of that. It's a pilot, small-scale study, but I think it's the direction we need to go, pulling people of multiple disciplines into this multidisciplinary issue.
I am now going to ask folks from the audience, please to come forward if you have questions, and ask for the panel, and please state your name and your location. And please use a microphone just so we can hear you.
Hi, I'm Bill Rahm from EPA. I have some questions about dengue. We heard that chikungunya has travelers that go to Canada. We know that dengue subjects go to Florida as travelers. Can we model an increasing latitude of dengue so that we can see it coming to the southeast U.S.? And you mentioned Aedes albopictus. Are we going to have a similar distribution with Aedes aegypti? And lastly, can you say something about parasites like filariasis? We haven't discussed that at all. And this has a tropical distribution. Will filariasis have any change?
Okay. I'll try and answer all of those questions. Sort that problem out. I think I don't think that the outbreak of chikungunya and dengue in the Caribbean, the Americas, can be linked to climate change. At least not at present. It's kind of associated with introduction, a whole load of other factors, reduced control, and it's a very complex. I don't know who spoke this morning about dengue being something that, I think it was Ben actually, who said that didn't really want it to it's terrible for people to model. So what's the limit for dengue? I don't know, someone's going to have to do where could it be? Could it be actually...
There were outbreaks in Philadelphia going all the way back to the 1780s, 90s, and things
so
like
that sort of corner of the U.S., which is where Aedes albopictus occurs, has been traditionally a place where malaria was controlled out of that area by habitat control and so on. So I consider that dengue is one of those it's really quite difficult to get a handle on, but it's probably time to sit down and think about it again, and we are doing in terms of from our perspective in Canada, thinking, well, okay, well, are we going to have Aedes albopictus here? Well, if we can then, well, can we actually have chikungunya transmission, and can we have dengue transmission, and where are all the travellers who are infected and viremic returning to? And you can start to build up this work. I know colleagues at CDC are working along the same lines. So I can't give you a hard and fast kind of limit to where it is and how far it'll go. Not yet. The complexity, though, of pathogens and parasites globally, and how that climate change is going to affect them, it's a really difficult issue for us to get a handle on. We have tried to put in. We can't do everything. We have limited resources at every level of kind of public health, and so we have to go with the hot button items. Some come and get us, like chikungunya, as it kind of emerges, and you have to do something about it. Some we can get to by, in terms of doing some kind of risk assessments, these sort of multi-criteria approaches to say, okay, which are the ones that we need to handle first. So that's the way that we're approaching it. That if it's something that is high on a list for a variety of criteria, well, that's the one we'll get to. I would warn against the idea of kind of cookie cutter approaches for these pathogens, because the ecology of many of them is very, very complex. And you need deep knowledge. You can say, oh, well, you can easily do some sort of simple statistical association that gives you, from distributions, that gives you some spurious or not link with climate change, and then applying a model. Whereas, in fact, the complexity can be, that might be nearly right, but it might actually be precisely wrong as well. So I'm very cautious about doing these, having a simplistic approach.
Any other questions?
Could I just add something to that, too? That I think it's really important to remember that just because the potential vector is in an area doesn't mean that the disease or the pathogen will follow. We've done studies in Mexico now where we found Aedes aegypti at 2,100 meters, but no dengue. We've had Aedes aegypti in Arizona at least documented in recent years, since 1994, and no locally acquired cases of dengue either. So I think that's another important thing to remember with it.
Next question, please.
Yes, Jonathan Miller from Yale University. And I think this sort of builds off to add another layer of complexity here. One question I'm always wondering about is, what about pathogen evolution? Particularly towards the end of the century, obviously, we're going to have a very different climate, warmer, wetter, whatever else. Particularly with the bacterial pathogens and stuff. How do we take that into account? Should we take that into account? Is there any way that we can start to think about evolution?
I think there is a branch of science called phylodynamics, which is all about that, isn't it? I mean, sure, that essentially you're changing the transmission cycles, which may change the fitness of different variants of a pathogen to make that some may persist and some may die out, but under conditions of climate change. I mean, it's something that we're interested in, and we've done a little bit of work on, but and particularly in the context of Lyme disease and the different strains of Lyme disease, and how that might, different seasonality and abundance of the vectors might alter the landscape of transmission. But I think, again, to do that in a prospective way in many systems is exceedingly difficult. But relevant, you're quite right. Yeah.
I think it's very hard to predict that. I mean, probably the best example of that we've seen in these recent years with this group of diseases is a chikungunya virus, in which case a single point mutation really altered vector competence, so that Aedes aegypti, and you have variants that are better transmitted by aegypti and others that are better transmitted by albopictus, and that makes a huge epidemiologic difference in terms of the distribution of those mosquito vectors, in the U.S. especially. So, but I don't see any really way of predicting that, but it's more likely to occur probably with viral pathogens than with bacterial.
Can I add one other piece to that? From a marine microbe, if you're a marine microbe, I had a slide I didn't use, and it had all the way from genes to satellites. So we're actually looking, again, with very little funding. It's not a core part of what we do, although we're trying to make it more of a core part of what we're doing to look at evolution in the marine environment of some of these microbial pathogens and other microbes that affect fish and shellfish. It is a really important question, and I don't think we're really equipped to, we're not addressing it as much as we should, but as we think about moving forward, where we might want to go is looking at what we monitor from a genetic level on up and looking at shifts at these multiple stages. We already heard about extrinsic and intrinsic incubation period. You just take that one step further and look at the evolution. It's a really good question. Need some money, though.
Next question, please.
John Balbus with NIEHS. It seems like we have a little bit of an intractable problem where we keep saying we need really fine resolution health data, but we're never going to get it because of privacy concerns. And I'm just wondering, for certain purposes, obviously, if we're looking at, census block by census block, public health intervention knocking on doors, you have to have that kind of scale data. But for aggregating health burden and modeling impacts, it's probably not as essential that you have the exact right person in the right place. And there are probably ways, we have other kinds of data. We have hospital discharge data, we have Google data, reams of Google data about medication. There are a lot of other data sources, almost analogous to the GCMs having to downscale down to the neighborhood level. What do people know about efforts to do simulated populations in this way, kind of downscaled aggregated health data to simulate populations, come up with a range of potential geographic locations of people with certain kinds of health conditions or diagnoses, and using those kinds of data as a substitute to at least be able to ask some of the larger scale questions?
I want to make a point related to I guess it's partly related to your question, but maybe it's not, but I'm going to go ahead and go. I think one of the issues we need to think about for spatial scale is there are many reasons it's important to go down to a small spatial scale. I want to get to the local level, but a lot of resources are being spent on getting models down to extremely fine spatial scale to a point where I would argue they may be less relevant from a public health perspective. For example, for the work that I talked about for atmospheric exposures, weather and air pollution, there's a lot of resources going down to get to a 1 by 1 kilometer resolution, but how many people do you know that spend their lives in a 1 by 1 kilometer block? Very few. And you can actually track for the United States the commuting distances and the trends in different areas. And so the idea that the 1 by 1 kilometer around your residence better represents your exposure than your community level or city level exposure is a pretty bold statement. So I think there's different issues of spatial scale and the need for spatial scale from a public health perspective than there may be from many of the other modeling perspectives like the ecological perspective and so on. And in terms of the data, I think there's issues of access to data that we've talked about, quality of data that we've talked about to some extent. And also I think it depends on what type of research question you're looking at, because some areas don't have the great data to look at, and I would argue many of the regions we really want to look at. But in terms of dealing with things like hospital missions, I mean, much of the major work for environmental health has been based on registry databases, so birth certificate databases, mortality databases, hospital mission databases. One of the things we're running into is really wanting to understand better the biological mechanism, because, nobody's death certificate says air pollution, or, the death certificates and hospital discharges that have heat in the title by no means are all of the ones that have been related to heat. So it's sometimes that these huge data sources that you're talking about sometimes don't have the detail that we may need for a specific question, and sometimes they're not available in the places that we want. But certainly, I think all of us are looking towards different types of data that may be available. So I don't want to be negative about those types of data sources. I think there's, we'll take all data we can get, but that's certainly not a full answer to the type of data needs that we have.
I'm going to ask the panel if they have any more comments on this question. We have to stop. Great stuff, but we really just have to stop time-wise. I request if folks have additional discussions, please feel comfortable talking to folks individually. We have a tremendous resource of folks, but if there's any last comments from the panel, I will take them.
I had one more comment to John's question. So I think on the issue of diarrheal diseases, these alternate ways of getting at data are actually really, really important, because people are not necessarily going to the doctor for diarrheal diseases all the time. So studies, I think it was in Canada that I'm recalling, they've actually, done surveillance of pharmacies for, sale of Pepto-Bismol and Imodium AD to try to understand when there seems to be spikes in symptoms associated with. So I think that type of data and learning how to mine it is actually going to be really, really important in the absence of getting, health data.
Just one to the same. There are ways of getting at it. There are ways of getting at it, but they need a bit of legwork, a bit of epi legwork.
Are people doing it? Where is it happening and how can we make that happen?
I'd like to thank the panel and the session speakers.
Thank you.